Kristia, I'm Maureen.
Hi.
I'm an exercise physiologist. What brings you here today?
So I just wanted to see an exercise physiologist just because I kind of wanted to see if I'm kind of healthy.
Okay. Well, I do have a questionnaire that I'm going to ask you. That way we can run through some medical questions just to see where you're at and see if it is healthy for you to begin exercising now or whether you need to go to a physician first.
Okay.
Okay, so I have 7 questions to ask you first, and they're all yes or no questions. The first one, has your doctor ever said that you have a heart condition or high blood pressure?
No.
Okay. Do you feel pain in your chest at rest during your daily activities of living or when you do physical activity?
No.
No? Do you lose balance because of dizziness or have you lost consciousness in the last 12 months?
Yeah. I actually did get super dizzy.
And if your dizziness was associated with overbreathing, such as during vigorous exercise, then say no.
No.
Okay. So your answer was yes? Okay. Have you ever been diagnosed with another chronic medical condition other than heart disease or high blood pressure?
No.
Are you currently taking prescribed medications for a chronic medical condition? Do you currently have or have had within the past 12 months a bone, joint, or soft tissue, which includes muscles, ligaments, or tendons, problem that could be made worse by becoming more physically active?
No. Not within the past 12 months, but 4 years ago, I had surgery, but that was 4 years ago. But I still kind of watch out for it because it's still,
Okay.
prim.
And has your doctor ever said that you should only do medically supervised physical activity? Okay. So because you said yes to one of the questions, we do need to complete 2 more pages of questions. All right. The first one. Do you have arthritis, osteoporosis, or back problems?
No.
Do you currently have cancer of any kind? Do you have a heart or cardiovascular condition, and this includes coronary artery disease, heart failure, and diagnosed abnormality of heart rhythm? Do you have high blood pressure? Do you have any metabolic conditions, which includes diabetes or prediabetes? Do you have any mental health problems or learning difficulties? Do you have a respiratory disease? This includes asthma.
My dad does though.
Do you have a spinal cord injury? Have you had a stroke?
No.
Do you have any other medical conditions not listed above, or do you have 2 or more medical conditions?
No.
Okay, we're going to go to the last page for recommendations. So you answered no to all of the follow-up questions about your medical condition. So you are ready to become more physically active, and you just have to sign the participant declaration below. So I'll show you right here. The participant declaration states that all persons who have completed the PAR-Q plus read and sign the declaration below. If you are less than the legal age required for consent or require the assent of a care provider, your parent, guardian, or care provider must also sign this form. So it states, I, the undersigned, have read, understood to my full satisfaction, and completed this questionnaire. I acknowledge that this physical activity clearance is valid for a maximum of 12 months from the date it is completed and becomes invalid if my condition changes. I also acknowledge that the community/fitness center may retain a copy of this form for records. In these instances, it will maintain the confidentiality of the same, complying with applicable law. So you'll just write your name, date, and signature.
Sign my life away.
It's
the date?
29th of August, 2018.
And then
All right, thank you. All right, with this, you're ready to start your exercise routine and become a healthier lifestyle. Congratulations.